In Chapter 8, we will talk about assessments, and this is a really important skill for a PFT. Now, using assessment protocols not only will lead to a personalized program design, but it will also help to keep the whole trainer and client relationship to be more goal-oriented. The gap that we've talked about bridging is something that starts at the point where the client can realize that there are some changes that need to be made to improve their overall health and function. These changes might not all be known at the time when you first meet with a client because the assessment process might reveal some of these things as you move through the different types of assessments that are used in fitness training. The end goals that you plan with your client represent the other end of the bridge, with goals being met and clients experiencing improved health, wellness, and conditioning. We'll describe assessments and protocols for performing them with clients in your operating environment. Let's take our first steps by explaining what assessments are and then get to know how to apply them with new clients. There are different reasons why trainers would use assessments to evaluate their clients. Now, when you think about making a professional recommendation, which is covered in the personal training sales chapter, you'll be able to see that referring to biometric assessments that are maybe out of range can also help to convince a reluctant client about training with you. When trainers do perform assessments, all guesswork is eliminated. It's important to do assessments properly to ensure consistent and valid results over time. Some newer trainers might feel a little uncomfortable about doing assessments at first, but if you're able to practice on coworkers or even friends, it can provide you with extra experience. Some assessments are considered micro-assessments, which are those times when trainers evaluate every rep of every set. The trainer is assessing the client for proper movement and for what they expect to see as part of their vision for the exercise that they want the client to perform. But it's also important not to get bogged down in micro-assessments because a good trainer also has to perform macro-assessments and keep sight of the big picture. One way to understand the difference between both micro and macro assessments is to say that a trainer would micro-assess every rep of every set and will macro-assess how strength and flexibility have improved over time as a result of a particular exercise program. The specific need to perform assessments with clients is due to the fact that trainers have to be able to uncover what the client is capable of at their current state of fitness or level of physical conditioning. Essentially, this means that we can understand our clients better when we know their strengths. With careful assessments, trainers can also help to reveal and correct weaknesses. For clients who require a medical clearance, assessments become even more important. Now, there is a time element to assessments due to the fact that the trainer will do both pre-program and post-program assessments to confirm change in the right direction. In this way, assessments are the trainer's way to verify if the program design written was both effective and appropriate. With positive assessment results, the client experiences internal motivation. Since change can happen slowly for clients, they may not see differences as drastic to what assessment results may show. So it's important to refer back to pre-program assessments to confirm positive changes with clients. We can assess overall health and fitness, skills, or functioning when we do assessments. We can also assess biometrics, which would include blood pressure or even body weight, just as two examples of biometric assessments that we typically do with clients. Then we can also consider how we would assess clients on both a macro or micro level. Now again, micro assessments are the small rep-to-rep observations that you evaluate for proper execution. This requires that the trainer has a goal in mind and has a certain vision of what they expect to see when the exercise is done by the client. This means also that the concepts related to biomechanics, kinesiology, and functional anatomy all come together to meet the needs of your program design. This provides the service part of personal training by doing the setup work in order to write an effective physical activity program for your client. Your client will also see the different parts of their fitness level that can improve with you providing direction and sound training principles applied to their unique situation, and this is all a result of the assessments that you do first. Sometimes assessments can become more involved, and this is especially true when working with people who are in special populations. Now, at times it can become too easy to get involved in the health history of clients when there are multiple chronic conditions present. In cases like this, remember to work within the boundaries of your profession. Work with your client and the instructions from physicians when required to, and as a best practice, refrain from comments about treatments regardless of experience or your background. But trainers also tend to overthink what the intent of the assessment interaction is. Don't lose sight of the fact that basically we are looking at overall health, fitness, and/or the client's skills. When trainers underestimate the value of doing complete and relevant assessments, there should be some obvious reasons why this wouldn't work very well. Trainers need biometric values as both a reference point and to make a professional recommendation later. But also, think about the message it would send to a client if you seem to be unprofessional in your approach to assessments or if you didn't follow protocols for exercise tests. At this point, ethical concerns begin to factor in. Our clients don't get our very best when we don't perform proper assessments. It's just not possible to meet the needs of a client if you don't know exactly what they might need. If you are not precise with your technique, or if you are inconsistent with assessments like skin folds, validity and reliability can become concerns. Accurate assessments can be validated by repeating the technique and getting similar results. It's always a good idea to inform your client about the assessment process beforehand. So in the 24 hours leading up to the meeting with your client, try to leave a reminder so that the odds of a no-show are decreased. It's also a good time to mention any special instructions about the assessment procedures that you'll be doing with your client. And if there are any special instructions for clothing or attire, be sure to inform your clients beforehand. Now, sometimes clients may seem to be disinterested in doing assessments because sometimes people don't want to know the truth or it can be embarrassing for them. Trainers should be able to describe all the benefits of doing a comprehensive assessment when there is any perceived resistance from the client. From your perspective, remember that you have an order to follow, and it's generally from those less physical assessments on up through to those that include more movement. And this is done strictly to evaluate resting levels of both blood pressure and heart rate. After you've completed this chapter, you will know all of the procedures and protocols used to get results for both physical conditioning levels and evaluation of skills with the client. Taking the time to do a complete health history has some clear benefits, and trainers cannot really expect to get to know clients without doing this at the time of assessing a new prospect. This is also the time when a PAR-Q, or Physical Activity Readiness Questionnaire, should be filled out by the client. Now, it's better to personally ask health history questions in a combined way also, not in line item style. So, if there are any answers that reveal the need to explore deeper, then trainers need to be able to feel comfortable doing this because it's important for a lot of reasons. The main one being the member's safety, and for being able to make a professional recommendation at the end of the session. Getting a medical clearance can be a challenge. Your clients are busy, and so are their physicians. You might be the only person able to take care of getting all the paperwork you need in on time. In these cases, do what is necessary but within reason. Other documents you may need or want could include food logs or any analysis spreadsheets, activity logs, tables or graphs to present to clients, client profile paperwork, and your business policies if you're an independent contractor. If you are an employed trainer, your club might instruct you on assessment protocols, and in the US anyways, most fitness club chains work to make this process more informative for clients. Your need for this information should also be transparent. There is a lot of useful information that comes from doing assessments that are both complete and accurate. Most of the time, this information is all done on a PC, so your skills will need to be on a level expected as standard in the industry. Because of the use of PCs in assessments, trainers don't really have to do long calculations or complicated math because it's done for you. But do these numbers have relevance? If you put someone on a bicycle for a VO2 max test and the result says 33 or 12, what do you do with that information? It's not something that you can really do anything with unless you know what the results mean and can attach some significance to them. It's something to think about. You will work with different equipment with different results. What should not change is how you will speak to your clients about what the assessment results mean, while staying focused on the client's big picture. If you're an independent, plan for the assessment to be a billable hour. This shouldn't change. Your ability to do any assessment is only limited by your creativity and transportation if you're doing in-home training. The need for business planning now should be clear because of the need to start out right at the first point of contact with a new prospect. Let's look forward and say that you have performed some assessments on a client and you feel that it's good to have the information when you're done, but what does it mean? Now, in most cases, you're comparing values seen in your prospective client against a standard or a norm. And in our industry, it's common to rely on policy from the American College of Sports Medicine in matters like this. We determine risk factors for cardiovascular disease and even body fat percent, all from guidelines established and observed by the ACSM. It is good to be familiar with the ACSM as an industry resource. Specifically, assessments will reveal postural concerns, cardiovascular risk factors, biometric values tied to weight, body fat, blood pressure, and heart rate, as well as the physical or fitness tests that are done to evaluate both VO2 max, muscular conditioning, strength, and even flexibility. Your manual describes the timeline for when adults should have a regular physical exam. Now, typically this question is included in most health history questionnaires. It's your choice if you decide to encourage a client to have a physical exam when you see the need. Some people don't like having that type of conversation, so it may be best to be very neutral or careful when you're talking to clients about health information and the words that you use to express yourself. But there is information that you will need to know before you can proceed. Is your client managing any aches or pains currently, or are these older injuries that could become irritated by a change in their physical activity level? Now, you will have clients that do have health or medical problems, and trainers need to be informed and skilled to be able to manage the training programs for these types of clients. If a client has no apparent risk factors but has not had a physical exam in over 5 years, what would you do? How would you approach the topic? Again, it's your decision if you should want to continue on without a medical clearance, even though there may not be any indicators apparent, but how you proceed will be based most likely on each individual case. It's important to learn all the abbreviations of our industry, and if you are to stay in the fitness business, you will see these and a lot more of them every day. You will need to be able to understand the best way to get a true resting heart rate from your client. This is an important number to know. Learning to take blood pressure with a blood pressure cuff and stethoscope is preferred over automated types for accuracy. Although most modern automatic blood pressure monitors are pretty accurate, you may not always have access to one. Frequently, these machines are criticized for showing results based on what is felt on the sensor pads and not heard by the human ear in the old school way. Body weight is another important biometric, but it is not the end-all be-all for what determines a client's fitness level, and this should be obvious. As an example, a male with a well-developed muscle mass may weigh outside of the norms that are established for his height or weight. In this way, it's important to remember that graphs, guidelines, or charts are just that. They are guidelines and recommendations, regardless of where they are referenced from. Since some assessments can be more subjective, it is probably best to know that you will become more experienced, accurate, and comfortable doing assessments the more you perform them. We have mentioned that body weight alone is not the most important indicator of a client's health profile. Body composition is more important because it looks at the ratio of fat stored to lean body mass present. Guidelines for body fat are expressed as percents, with the American College of Sports Medicine guidelines forming the basis of comparison. The most common method used to determine body fat is through the use of skin fold measurements or the method known as bioelectrical impedance analysis or BIA testing. Your manual provides more information on the different types of assessments used for determining body fat. It is important to remember that all forms of body fat measurements are referenced as a comparison to the so-called gold standard of assessing body fat, known as hydrostatic weighing. Since this type of underwater weighing is not practical, its usefulness is not as clear for trainers in the field. Now, the communications to a client about weight and any other biometric result should be done with great care. If you are able to stick with science, it's always a good way to stay on point and to stay neutral. Still, there will be times when you have to initiate conversations with clients when you talk about goals or explain results. So it's really important that you improve your skills and experience with this to be able to have it flow seamlessly. The direct benefit to the trainer for doing assessments is that when they are done, you can put the client's program together and it will be personalized for their needs and goals. You may not have time to do a metabolic assessment as they are described in your manual, or you most likely won't have access to the equipment needed to complete this type of test. If there is a need for a client to undergo a metabolic test, a referral to an RD or other health professional would be recommended. Now, using cardiovascular equipment is typically the most practical way to perform a sub-VO2 max test, but your manual also explains ways to get these values, including the use of polar heart rate monitor technology to both easily and accurately complete the testing protocols for VO2 max, resting heart rate, maximum heart rate, and target heart rate. Remember that trainers do sub-max testing. All higher or advanced levels for this are done in a clinical setting, with a doctor's supervised treadmill test being the most accurate way of assessing VO2 max. Your fitness assessments will include evaluations of flexibility, muscular strength, endurance, and for some, it would include muscular power. These assessments are also outlined in detail within the pages of your manual. The most important information that you might get from doing an assessment could come from the time spent filling out the health history and the PAR-Q questionnaire, especially if there's any signs of a need for medical clearance. Now, in these cases, some fitness tests should not be done until the medical clearance is in hand. In other words, we would not want to do a sub-VO2 max test on a prospect if they were in need of a clearance first, revealed in the health history interview. Now, keep in mind that your available time and priorities are part of the assessments. You may need to spread them out over 2 different sessions. Do what's required to get the information that you need. When considering goals, it's important to know that this is where so many times we get this wrong for our clients. We enroll them in our clubs and we encourage them and tell them that they're going to be so much more healthy and fit, and we might get them set up on a program, and then the majority of them will fall through the cracks because they go off and they do their own interpretation of what a fitness routine should be. This person might hit a goal if they are even aware of what their goals or needs are, but they might have more complex or difficult goals that require the help of a specialist. And this is why people come to a trainer to help them reach their goals. But if we fail to truly find out everything that we can about our client, we cannot make goals important enough to bring them to the forefront. When you are able to make the assessment session about the needs of the client, you provide positive reinforcement to a client who is looking for you to keep their health and fitness interest managed. But another key element feeds your business as a trainer. When you have proven success with many clients, you show an ability to be goal-oriented, and this is an attractive characteristic of any professional providing a service. The core of making your professional recommendation comes about only after you've learned what motivates your client to become physically active. Goals and motives work in sync and cannot be separated in your approach. This type of motivation is typically the more internal type and only comes through when a client is communicating openly. Try to work with each client to be sure that the goals that you determine follow the SMART outline. Now, clients won't know the time frame for change to take place, so timelines become a factor in not only knowing how long it takes to hit a goal, but how long you expect to work with this client as their trainer. This is also something that should be considered in the context of making your professional recommendation. At times, when you are either between or after a microcycle, you will want to reassess your client. This is the point where you are able to verify your program design or discuss opportunities to improve it. Now, in the busy lives of our clients, there will be some common obstacles or barriers, including some time constraints or commitments that keep clients from getting to the gym. Usually, these will be identified during the initial evaluation that you do with each client as you come to learn about the time demands of their jobs or from their families. To really be able to get at the true goals of your client, you have to take the time during the goal-setting steps to get to know them in a professional way. And when this is done right, you can come to expect that you will not only know your client enough to write a proper program design, but the benefits the client experiences also support good business strategies. We cannot train clients without assessing them first. It's one of the most important steps in the early stages of developing a relationship with a prospect or a client. This is your chance to wow the client, to make them feel that you care about what's important to them, and to write the ideal program. Therefore, the benefits of assessments should be clear. Basic assessments are non-negotiable because of the safety built into the protocols and the fact that a PFT cannot proceed without knowing health history or other specific facts tied to a client's health, fitness, or wellness. Some newer trainers can feel pressure when they start to perform assessments, but this is normal and will decrease over time with practice and experience. When you are doing assessments, remember how much information you will get from the client and how important it is to have this information before moving ahead with any exercise programming. When we talk about macro cycles, we are referring to a length of time spent training a client. This can be really any time frame or timetable that's relevant, but is typically at least 6 months to a year. Even if you do not perform post-test assessments with clients, trainers should still do some form of post-testing after the appropriate time has been allowed to work through the microcycles that make up the training calendar for your client.